Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Safety and the Older Adult, Episode 2, Fall Prevention. After viewing this episode, participants will review common fall hazards and causes for falls. Participants will also learn how EMS can prevent falls in the older adult. Finally, participants will be made aware of community resources available for older adults at risk for falls.
Well, environmental hazards actually account for 44% of falls, whether it's outside the home because of environmental factors, inclement weather, especially in Rochester, the snow, the ice, they're not clearing their snow, they don't have somebody to come clear it for them. But inside the house more frequently is stuff like area rugs that aren't picked up or don't have the slip underneath of them, electrical cords, too much clutter and stuff hanging around. Thresholds between rooms is a big problem if they can't clear their foot or they can't use their assistive device to get through it. Poor lighting, and these things just get compounded if they have other medical issues like neuropathy or orthostatic hypotension, so that when they stand up out of bed in the middle of the night and the lights are off and they need to go to the bathroom, a lot of times they'll trip and fall then.
Falls in the older adult are frequently associated with environmental conditions such as snow, ice, and rain. Conditions in the home that frequently cause falls include area rugs, electrical cords, clutter, thresholds, and poor lighting. According to the Centers for Disease Control, every 18 seconds an older adult is treated in the emergency department for a fall. Every 35 minutes an older adult dies as a result of their injuries from falls. 1 in 3 older adults will fall in a year. However, there are strategies that can reduce falls and help older adults live better and longer.
Usually a home physical therapist can come right out to the home and assess the entire environment, and they can go through a checklist with the patient as long as the person is open to a therapist coming to the house. For the people who don't want the help or are less accepting, to give them an entire checklist of each room of things that they should go through and look for and modify on their own, whether it be night lights or removing the area rugs or installing grab bars, so that they can do it on their own so that they feel like they have some control over the situation, or give it to a family member so that they can do it together. Better than that would be to have the therapist come into the home and assess everything and go through it step by step with them, but a lot of times they're not open to that.
I would say any adult that is at risk for falls, it's very important that either the family communicate with their primary care physician their concerns about the older adult being at risk for falls, or if there's no family and an EMS provider goes into the home and notices that there are different risk factors that puts this person at risk, they should definitely inform the triage nurse and the social worker in emergency.
If the EMS can actually sit down with the patient and consult with them and go through the checklist and talk with them about the things that need to be changed, that would be the best. But if they can also talk to a family member so that somebody else is there and knows about the conversation. But once they get to the hospital, social work can be alerted, or the medical staff, so that they know that the condition that the patient's living in.
Talk to them about different things that might put them at risk. If they see that this patient is really weak and they have to climb 60 stairs, maybe suggesting, have you thought about moving into a first floor apartment? Have you thought about rearranging your furniture in such a way? I know they have time constraints and they don't always have that opportunity, but maybe even on the way to the hospital, having some of those discussions if they're able to.
If the person actually comes to the emergency department, physical therapy can be consulted to come down and work with them before they're discharged.
The best way to assess the home is to have a home physical therapist go through the home with the individual and identify hazards. Older adults are sometimes reluctant for the service. Checklists for rooms can be given to the individual or family member to aid them in identifying hazards. EMS should identify and communicate fall hazards when in the home.
There are a ton of assisted devices. There's canes, straight canes, and quad canes. I've seen people use canes on both sides, which probably isn't a good idea, but for some patients it just works better. There's walkers, rolling walkers, and standard walkers, and rollators that have the bench and the basket so they don't have to carry stuff. Usually the rolling walker is safer than a standard walker, which gets confused, but the standard walker, they have to pick up every time they want to move it, and the rolling walker is really better because then they can just push it and keep it on the ground the whole time. There's lost strand crutches and regular crutches, which you don't usually give to elderly people, but sometimes they have their place. And then assistive devices for ADLs are really important, so tub benches so they don't slip and fall in the tub. raised toilet seats so that they have an easier time getting up, down off the toilet, the grab bars in the bathroom so that there's something for them sturdy to hold on to, and not their walker that they can pull right over on top of them. And then there's long-handled reachers to pick things up off the ground, or shoehorns, so they're not bending over and then toppling over on top of themselves. There's safety buttons that they can wear that call for help if they've fallen, which really every elderly person should have, just in case they are running to the bathroom in the middle of the night, or they're hurrying to get to the telephone and they trip and fall. And the last thing would be to have them consult with their primary care doctor so that they can look at all the medications that they're taking and see if they're all appropriate, if they need to be taking all of them, and if they're taking them correctly. And at that time, the doctor can also ask for physical therapy.
There are a variety of devices available to assist the older adult in mobility. Using an inappropriate device can lead to an increased risk for falling. EMS should ask what devices are used to see if the device may have contributed to a fall or potentially will. Using appropriate assistive devices for daily tasks are very important for the older adult.
It's important that the receiving facility know what the home environment look like, because the facility isn't able to go out into the home. So we're counting on EMS providers to tell us what the home looks like. If there are some true concerns, whether the patient has a lot of clutter or different items in their home that's putting them at risk, or whether there might be some kind of abuse situation at home, I think it's important to go a step further and contact Adult Protective Service through Monroe County, which you can do through calling 211 Lifeline. They will connect you directly with Adult Protective Service. There are several resources in Monroe County for adults that are at risk for falls. First of all, the primary care physician can send a referral to a nursing agency. The major companies in Monroe County are Visiting Nurse Service, Home Care of Rochester, and Lifetime Assistance. They will go into the home, they'll evaluate the home, they'll decide whether or not the patient needs some kind of medical devices, if the home needs to be kind of cleaned up or things need to be shifted so that there aren't obstructions or things that might put the patient at risk of falls. Now, if the patient has fallen in the past and continues to fall, there are agencies in the community that will evaluate the patient and determine whether or not the patient might require a higher level of care. And that agency is called Traditions in Caring. Also, visiting nurse can do this assessment, Lifetime Assistance. They will assess the patient, determine if they need to go into rehab, either inpatient or outpatient basis. At Strong, it's quite unique in that we have social work staff 24 hours a day, 7 days a week. So if there is a patient that EMS thinks is extremely unsafe at home, whether it's an adult or a child, it would be important to talk with the social worker on those cases, because sometimes it's lost in translation. In the overnight, another agency that can go out to the home is called Facet, and they are through the Rochester Police Department. You can call them, they can have support services. They're not social workers, but they are trained professional caseworkers that can go out into the home, work with the family to determine, again, if it's a safe situation, if the patient should be staying there or going back there. If the EMS provider doesn't know what resources are in the community, you can make one call to Lifeline 211 and you tell them what's going on, they will connect you.
There are a variety of resources in the Rochester area to support older adults, specifically in regard to fall prevention. Such resources include Adult Protective Services, Visiting Nurse Services, Home Care of Rochester, Lifetime Assistance, Traditions in Caring, and the Rochester Police Department. EMS can contact any of these agencies through Lifeline at 211. EMS has a unique opportunity to view the older adult in the home. EMS should be observant for fall hazards in the home and educate individuals of such hazards. If the patient is transported to the hospital, notify triage for a social worker consult. Document the environment well in your patient care report. After viewing this episode, participants will review common fall hazards and causes for falls. Participants will also learn how EMS can prevent falls in the older adult. Finally, participants will be made aware of community resources available for older adults at risk for falls.